With relationship to other disease, you've covered that in your other books. Where do you see allergies fitting into all of this?
It's a very important disorder that we have. Liver dysfunction. It's a loose concept because we all have a small degree of liver dysfunction. But the prevalence of allergies now, and especially what we call environmentally sensitive people or multiple allergies, that is very significant. It should be as a bugle call to us. Hey, look, something is happening to your liver. The liver can no longer detoxify a large number of chemicals that you are getting into you, and you better not do that.
Allergy, we could say, is a kind of a civilization sickness. We read a lot of clinic reports that Indians in the jungle or somewhere don't have any allergies. And so it is very clear that civilization brings allergy with it. And the experience we have is that people start allergies with 1 or 2 allergies, and sometimes it's not that harmful. But after years go by, which means that parasites can develop, they can have more toxins in the body, then they develop more and more allergies.
It's very interesting that in Europe there's a high acceptance for natural and herbal remedies. More and more people are trying to get well on a natural way because they see the limits of the highly toxic chemical treatments that we see.
What other diseases are you seeing cured?
We see very fast cures in diabetes. We see people get negative with HIV. And basically on very simple things, I had a wart myself behind the ear, I zapped and it fell off.
You have an interesting treatment that you suggest in your book called the liver flush. And what is the relationship with the liver flush and what we're talking about here for purging the body of bacteria?
It does purge the body of bacteria very nicely. I don't incorporate it in the 21-day program because the patients are too sick to be going through a liver flush. They can do that after they get a little better. But in the book Cure for Cancers, which is for earlier cancer stages, and the other books where people are just ill of other diseases, cleaning the liver is probably the most effective thing they can do to get immediate relief of many pains and many problems, say a digestion problem. Pain in the shoulder is very, very typically improved the very next day.
Did you invent this liver flush?
No, I didn't. I only experimented with it repeatedly to develop something that was reliable so that if anybody did it, say 100 people, at least 99 of them would get stones out.
Now you say stones. I mean pebbles like we see on the beach?
Sometimes they're pebbles like you see on the beach, small, gray, very hard rocks. But most of the time they're larger, green-colored, roundish objects, the size of a bean or a pea or a lima bean, and sometimes much, much larger.
Could we see these with an ultrasound or an MRI or an X-ray?
No, you can't because they don't have that much density difference from your tissue. To be able to see something, say on X-ray, it would have to be calcified, and on an ultrasound it would or a scan, it would have to have quite a density difference, and it doesn't. It's really just made of cholesterol crystals, garbage, and mush.
As part of Dr. Clark's program, she encourages the liver flush. And in my nutritional consulting practice, I've been doing the liver flush for a number of years. Dr. Clark has helped me to even perfect it to a greater level. The liver flush has been a popular remedy for flushing the liver, the colon, as well as the kidney for a number of years. In fact, it dates back more than 2,000 years ago. The Egyptians were actually doing it, where the Egyptians would travel across the desert, get the salt out of the Dead Sea. They would bring it back and they would put it into the kings with a combination of lemon and sea salt, and they would flush the liver this way. Well, we have a more sophisticated way of doing it now, using Epsom salt olive oil and grapefruit as the grand finale, and we'll just show you how we build up to it to prepare the body so that the body can eliminate some of the toxins. The first thing we use is a beet cucumber juice here, and the beet cucumber juice helps to alkalize the body as well as clean the liver. And then we also use black cherry juice, which helps both eating the cherries and drinking the juice to cleanse the kidney. And then in addition to that, for cleansing the kidney, we also use a tea made from uva ursi. Now we also use, for both the kidney and the liver, a combination of apple and lemon, and to that we add ginger. The reason why we suggest the ginger, the apple, and the lemon is because it really does help to emulsify the stones. So if you do this 21 days prior to the actual flush itself, you will emulsify a lot of these crystals that can accumulate in the liver. In fact, we actually use this formula of apple, lemon, and ginger as the first drink after the liver flush, just to help get rid of some of the toxins and clear the liver of any extra crystals that might not have come out in the liver flush itself. Dr. Clark has found that this combination of black walnut and super blend of wormwood combination and cloves kills the parasite, the specific Fasciolopsis buski. And the best method for cleaning out the liver is to go in and use these products first for the first 3 weeks, and then on the day of the flush you stop using all of these products, and then you just go straight to the vegetable juices. And by the way, on that day, stay completely vegetarian and stay off of all the fats that particular day as well. So you'll build up the bile pressure in the liver and you'll get a more effective flush. In the digestive tract, she suggests that we use betaine HCl. So that helps drive all the bacteria down into the lower intestine where it can live there out of harm's way. And then in the teeth, she suggests that we brush our teeth with the oil of oregano. And the way we do that, Jane, if I could just have your hand here for a second, we just put a little dab on the finger, about that much, a drop. Then you take the toothbrush like this and you rub it on the finger, absorbing all of the oregano oil. This is very, very hot, hotter than cayenne pepper actually. And then you just go about brushing your teeth with it, which Jane can do now because she's preparing for her liver flush. You brush your teeth with it, and that kills all the Clostridium bacteria in the teeth, preparing the liver then for the flush itself. To do the flush, what we normally do is we stop eating at 2 o'clock in the afternoon. Now at that point, we allow the body 4 hours to get all of the food through the digestive tract. Then we introduce the body at 6 o'clock to the first glass of Epsom salt, which we have here, just regular Epsom salt, and about 1.5 tablespoons in one glass. Now inside this glass of water, we've dissolved 1.5 tablespoons of Epsom salt, and she'll do that at 6 o'clock. Then the second glass of water is also 1.5 tablespoons of Epsom salt that she does 2 hours later at 8 o'clock. Now in between these two times, it's not mandatory, but it does help to do a foot massage, which you can use on a foot massage machine, or you can just have your spouse or your mate give you a foot massage. It would really help to sit in a chair with your feet elevated at least to allow the lymphatic system to cleanse itself. Now at the same time, I suggest you prepare 2 other glasses of 8 ounces of water each with 1.5 tablespoons of Epsom salt in both that you'll lay by the bedside, and one will be drank at 6 a.m. in the morning and the other one will be drank at 8 o'clock in the morning when you'll get out of bed. So the first Epsom salt Jane does at 6 o'clock. The second Epsom salt she does at 8 o'clock, and then 2 are prepared for 6 a.m. in the morning and 8 a.m. respectively. So once she wakes up in the morning, the Epsom salt's going to help encourage the bowel to eliminate. The reason why Dr. Clark has picked Epsom salts, of course, is because the magnesium sulfate helps relax the liver and the bowel so that the stones can roll out easier. Her body's now prepared to take the liver flush itself, which is a combination of olive oil and freshly squeezed grapefruit juice, and we just use a regular citrus juicer for this. And usually you get about between 2 and 3 grapefruit should give you about 8 ounces of grapefruit juice, and that's all you need to do this. The grapefruit juice, of course, that we get is pink, and we filter it to make sure that there's no pulp. And then in combination with the olive oil, It perfectly prepares the liver so that you can eliminate